Hello friends, let us now learn some important points about endemic critinism. Endemic critinism is a most serious consequence of iodine deficiency. This endemic critinism will be two types. One, we have neurological critinism. One is neurological critinism. Second, we have myxedematous critinism. In neurological critinism, the child presents with deaf, there will be squinting, there will be gait problems like spasticity and rigidity, and the child will have intellectual disability. In myxedematous critinism, the child will have retarded psychomotor development, there will be short stature and coarse facial features are seen, that is puffy face, large tongue, skin will be dry. So all those are seen in endemic critinism. So in order to prevent this endemic critinism, you will have this endemic critinism is mainly due to the iodine deficiency. So to prevent it, we will have to treat it by iodine supplementation, or you will have to ask the child to take required dietary allowance of iodine should be taken properly. So required dietary allowance of iodine for children less than 10 years of age, it is 40 to 120 micrograms per day, and if it is and for more than 10 years, the required dietary allowance of iodine is 150 microgram per day. This is about endemic critinism. The last so thank you for watching. Thank you.